Innovation Unplugged from the Alabama Community College System's Innovation Center takes you inside Alabama's workforce development. Join us for enlightening conversations with community leaders and industry experts showcasing experiences, addressing key issues, and celebrating successes in the workforce initiatives across the state. Hey friends, good morning or good evening, whichever it is for you. Welcome back to another episode of Innovation Unplugged, production of the ACCS Innovation Center. We are a division of the Alabama Community College System. We are the fun bunch. We get to do things that no one else gets to do. And today, I'm Houston Blackwood. I'm a workforce director for this group. And today I've got Jesse Gibson. He is the clinical program director for Crestwood Hospital Wound Care and Hyperbaric Medicine.
Yes.
That's a mouthful.
Yes, it is.
But just so the world knows, in my phone, he is called LL Cool J.
Thank you.
And sometimes I forget that, and I start to search for Jesse Gibson, and he's not in there. I'm like, what in the world?
Mama said knock you out.
Mama said. But also, on the same note, Jeremy Huff is Senior Chief Huff. And then Derek Sheedy is Rubber Ducky.
Okay.
I don't know why, as a grown man with a college degree, that I choose to do those things.
Yeah, in my phone, you are Houston Blackwood. So
why are you so serious? And I'm not.
I don't know.
Like, you're the professional one here.
Not really.
In this relationship. Okay. Well, in case you didn't realize, to listen to the audience, which really I think is my mom and like some random person on the internet, Jesse and I know each other for a long time now. And I don't remember how long it is. I think it's from T-ball.
Definitely Bethel Baptist.
Oh, is it way back? Yeah. Okay.
Yeah.
That was T-ball age.
Yeah. They were 3 years old. So our two youngest children, Cohen and Rowan, were at a preschool class together, Bethel Baptist, and they were big buddies then, and now they're lifelong friends. So.
Yeah, that's the truth. And so we were on the T-ball, the Scooby-Doos.
Scooby-Doos. They were number one rated 4U T-ball team in the state of Alabama.
Yeah, well, there are damn lies, and statistics. And I don't know what that one is, but
nobody will ever know.
No, that's true. So that's true. We've known each other a long time, and in fact, your wife came on, Danielle Gibson, probably last year sometime, to talk about tourism and our hospitality courses and everything. So,
she's a baller.
She's a baller. Your whole family's ballers, and you've got an older son, Noah, who is rock star of his own kind.
Yes,
yeah.
He is. He's actually a three-time state champion in CPR and first aid for HOSA.
Mm-hmm.
He'll be coming down to Tuscaloosa for college next year.
Yeah, that's cool.
To study aerospace engineering.
Yeah, he's wicked smart.
Yeah.
He's like Ben Affleck smart.
He doesn't get that from me.
He doesn't?
No.
I would have not have guessed that.
He gets that from Danielle and her father.
Well, she is sharp too. One of my other friends is like, hey, you have an interesting friend set. I'm like, what do you mean? Like, well, they're all different kinds of trades and professions, but they're all smart.
Yes.
And also capable. I'm like,
100%.
You are the sum of who you surround yourself with, right? The 5 people you spend time with.
Product of your environment, yes.
So, well, it's good to catch up so the world knows we've met. But one of the reasons why I wanted to come on, I thought it'd be funny and a fun conversation. But we are rolling out our nurse support technician course. Should be any time. Like, we finished all the pilots and the course build and all that. So the nurse support tech will be acute care, patient. Well, there's a lot of things, but basically they're taking care of the patients in a hospital setting. All the things that nurses may not do. Right. You're familiar with the concept.
Huge need.
So we heard that, and Alabama Board of Nursing came to us a year ago. It was like, hey, we need this because we've got all these different certificates or whatever that aren't regulated by anybody. It's just like, Sally Nurse, retired nurse, started her own little program over here, and it's called Sally's Nurse Care Facility, whatever, training. And you got this other thing. So they wanted all of it in one bundle, and it's extensive. Like, it was a lot to build, and Seed Creative helped us film everything, but. So now we have this, and so everybody that goes and gets that degree or that certificate can work in a regular hospital or clinic like yours or whatever. And we've heard it's one of the greatest needs in the state.
Yeah, I think that's a huge need. Nursing is really kind of geared towards case management of patient care.
Mm-hmm.
So those kind of tasks that aren't necessarily falling under the scope of a nursing practice license, they need to delegate that responsibility out.
Mm-hmm.
And what they have now are a couple of different things, several different options, like an MA. They have options for patient care tech. They have options for CNA, certified nursing assistant, etc. So anytime you can bundle everything under one scope, I think the better off everybody's going to be, because they're going to know what their scope is.
Well, and that's the thing too. Like in one of the questions, getting down to it, and this is really technical, but I mean, that's why we do the shows. We explain what we're building. Is what is the nurse supervising, delegating, and supervising, or just delegating? And we'd say it's delegating and supervising ultimately.
Ultimately, yes, because whatever that nurse delegates out, it's their responsibility to oversee and make sure that that task gets performed correctly.
Yeah. And
because
so
patient safety is ultimately, every medical professional's goal.
Yeah.
And we want to make sure that we're providing safe and effective patient care.
Yeah. Well, that's what Ms. Benson, Peggy Benson, I'll say director of the ABN, president of ABN, super lady, big fan of us and big supporter. But she said that it's like, if it doesn't make the patient safer and their experience better, we're not doing it.
Right.
So as we built the course, and they guided all that, and so it worked out well. So give me the background, give the audience the background on your experience from Jesse Gibson graduated high school to and the brief version, brevity is king. Sure. We only have 45 minutes, but from I don't know, because I just graduated high school to, and maybe that was your experience. I think it a little different, but now you're like running the show. Is it a part of Crestwood,
so to speak? Yeah.
Yeah.
So my wife Danielle told me to keep everything brief. She said, Jesse, don't give them the entire backstory.
Well, that's fair. Yeah.
So backstory, my father is a mechanic, right? So I grew up turning a wrench.
Yeah.
I knew I didn't want to do that when I graduated high school. So I took 3 years of brick masonry in high school. So, hey, I can lay some brick too. Then ended up kind of floundering around for a couple of years, tried college a couple of times, didn't really work out. It wasn't for me. So I actually did lay brick as a job, worked in a couple of factories, met my wife, had our first child, and ultimately needed to move kind of closer to her family because they could help support childcare where we needed. And in order to do that, I needed to find a job closer to them, and I got into HVAC. So I did HVAC for several years before I decided, hey, I need to go back to school. Well, during this whole process, my wife was in school too, and she graduated in 2009. So in 2010, I decided, hey, let's kind of change our family tree, and I got back into school with the goal of becoming a teacher. Kind of 2 years into it, I was about to transfer to Athens State and pursue that. And Danielle and I sat down. We had a conversation. Maybe this is not really the best option long term. What we need to do is look at what you like to do, Jesse, and then kind of pick something from there. So kind of medical field, I gravitated towards that because, I love people, love providing care for people.
Yep.
Anyone who's empathetic naturally, they're going to be a good care provider. So it was an easy fit for me. So immediately I started working in the hospital once I decided to go that route. I had to backtrack in school, however, and get another year of prerequisites before I could apply to nursing school. So I did that. I'm working as a CNA unit secretary in a hospital in Decatur, and, going to nursing school, coaching baseball teams all at the same time. It was pretty crazy, hectic. Life is life, and, it's very busy. But ultimately ended up graduating nursing school from Calhoun Community College up there in Decatur, and got my RN. Graduated May of 2015. And then I went to work immediately in an ICU.
Wow.
And that is how I became a nurse.
Yeah. I like your journey.
Yeah.
A guy before you, the previous episode, Frank, he's a plumber, and he went to school for music management. and now he's a
Wild.
master plumber.
Yeah,
You
it's
know,
wild.
and so like you see these things, and we tell our students all the time, like with our courses, like, hey, you take this course in high school.
Yep.
It's a career prep, but it might be a career exploration, and determine if you like to have a skill saw in your hand.
Mhm.
If you don't, that's okay, because you can go over here and put a machine in your hand or whatever. But you find out what you like, so that when you're 18, 19, you're making those decisions. Where a lot of us, because we weren't exposed to a lot of things our age, like, you're going to go to school or whatever. Like, well, I don't know.
Right.
I don't know what I want to do, but I'm going to get my degree and spend a bunch of money doing it and a bunch of time. And
It's so true.
so I tell this all the time, and it's like, hey, well, what if you could get high school kids who are looking in this viewpoint for their future career, and you could whittle them down to this at 18 years old, or maybe even this, like.
Yeah, that's a big deal, because a lot of times, me and my profession, I will see a lot of RN burnout or nurse burnout, medical professional burnout, because they may not have necessarily known exactly what they were going to get into before they started working in the medical field. So you see it a lot. We have students from various community colleges come to our clinic, our hospital system. Do we need a backstory who I work for?
I think so. I think it's a good segue, because you ran through all that and you stopped at the RN part and where you got the job at the ICU. So because that's an important reason why you're here too. Yeah.
So one of the beautiful things about working at the particular hospital that I worked at initially was it was a small ICU. So I had a ton of experience with so many different things. So it was not a specialty ICU. It was one of those ICUs where we've got medical, we've got surgical, we've got cardiac, we've got a little bit of neuro. So you get a big scope of the things that you can kind of try and see what you gravitate towards.
Oh, yeah.
All at the same time, you're gaining so much valuable experience, and figuring out who you are and what specialty you want to go after. And in case anybody wants to know, you really want to kind of go towards a specialty once you figure out what you're going to pursue.
Yeah.
And once you do that, go at it. So certifications and stuff like that after you get your nursing license are extremely important. So I would advise anybody, hey, if you're going to be an RN, do that, get a little bit of experience, figure out what you like, and then pursue that specialty.
Yeah.
So my specialty now is wound care. It didn't start out that way. I never saw it coming, but it got here. And kind of how we got there was basically, I said, hey, I'm working in the ICU, got a lot of experience there, had a really long weekend shift, and I guess I was kind of getting burnt out. I was one of those people. And so what happened was, there was a Monday morning after a long weekend, I got a text message. I'm trying to sleep and get some rest. I got a text message from some friends that I used to work on the 4th floor with. And so they said, hey, you need to come work with us. And I'm like, okay, what do you do?
I don't care. I'll do it. What is it?
And they're like, well, we do infusion. And I'm like, that sounds fantastic. So I'll start IVs and stuff.
Yeah.
Well, yeah, that's part of it, but that's not really all of it. And so I went and had a conversation. It never hurts to have a conversation.
Yeah.
Have those conversations, and then you'll figure out if it's a spot for you. So I said, okay, this is a spot for me. So I go, and I'm working there probably, 6 months at the most. And it kind of transitioned into something bigger for me.
Yeah.
It got me more into a leadership role. And it's kind of an undiscussed assistant director of nursing is basically what it ended up being. And so I did that for 4 years or so. And I had this one nurse who was going to school and she was getting her master's. And while she was getting her master's, she had this plan. She was going to move into a different role. Yeah. Just change jobs completely. Well, her primary job was the clinical nurse manager at the wound care center.
Okay. Which is your job now.
No.
Ish.
It was. No. So it was my job, and then it changed. So she's the clinical manager who's kind of provides clinical oversight for the day-to-day kind of clinical aspects of running a wound care center. And so I went and had that conversation because, like I said, it doesn't hurt to have conversations. And I found out, hey, it's worth a shot. Let me go give it a try. And so, therefore, I became an employee of Hillogics Incorporated, LLC.
What year was this? Because I remember that shirt. That
Hillogics.
Logo. Yeah.
Yeah. So that was August the 24th of 2020 was the first day I started working for Hillogics as the clinical nurse manager of Crestwood Wound Care and Hyperbaric Medicine.
Okay.
Yeah. And so that was probably the hardest thing I ever did, was transitioning from ICU, infusion, and then having to learn everything I had to learn to become, 1, a leader of people, 2, wound care, 3, hyperbaric medicine. So that was extremely difficult, but we managed to get there. And luckily, the people that I've surrounded myself with, basically through osmosis, because of my wife and who she is and who you guys are and who all we hang out with, the leadership aspect of everything kind of came easy for me. So luckily, I had a leader above me at Crestwood who kind of bought into the wound care center. So he made life a lot easier, and that's Drew Davenport. And then I had some leaders at Hillogics who really kind of mentored me too and helped me out a ton. So fast forward 2 years, and the program director for that wound care center left, and it was an easy transition for me to move into her role. And so now it's my role. And so what I do, I basically oversee day-to-day operations on the business side, marketing, etc., for Crestwood Wound Care and Hyperbaric Medicine. And FYI, Hillogics is the world-leading expert in wound care. So Hillogics provides science, clinical practice guidelines, hyperbaric chambers, and education to all wound care center staff.
Okay.
Where they partner with the hospital system. So it's basically like a contract situation. And so Hillogics has roughly 630 some odd wound care centers across the United States, a couple in some other parts of the world. And we have probably the highest healing rate out of every one of them at a 95% comprehensive wound mix adjusted healing rate.
So you just threw down some incredible stats about a lot of things, but also you threw out some scientific medical terms that I'm not tracking. So there's a wound and it's gross and it's not clean and it's not healing. And so you do some funny stuff with, I'm thinking, some pressure and some medicine. So for a future NST out there and people like me who are clueless about healthcare, what is hyperbaric wound care?
So hyperbaric medicine is kind of an old Navy thing, right? They developed this for deep sea divers who suffered decompression illness.
Okay. The bends.
The bends.
Yeah.
100%.
Okay.
Yeah.
Do you put people in that big tube, like with just their neck is sticking out?
No, that is an iron lung. So
I'm dumb.
Yeah, so
dumb.
That's basically an old school ventilator. So a hyperbaric chamber they can be a multi-place, which means more than one person can go in there, or they can be a monoplace, which means one person goes in, and then we monitor them from outside.
What do you mean by going in? Like I'm sitting in it, or I'm walking in it, like it's squeezing around me. Like freak me out a little bit here.
It's the chamber of secrets. Yeah.
No, I need to know. The world needs to know. Seriously.
So it is a probably 7.5 foot clear acrylic tube with steel casings on each end. Mm-mm. And there's a huge barrel lock that once it closes, you can't get out from the inside.
Nope.
And
just give me some Neosporin, bud.
We pressurize that chamber.
Oh, God.
Ours at Crestwood can go to 3 atmospheres of pressure. So
we're at 1, like right now.
So we're at 1. You're so smart.
I had 3 semesters of chemistry.
Yeah, we are at 1 atmosphere of pressure right now. And depending on the indication, while they're diving, we can take them up to 3 atmospheres of depth, or down to 3 atmospheres.
That's what you're simulating.
Depth.
Okay.
Mm-hmm. But while they're in our chambers, they're breathing 100% oxygen. And what we treat with hyperbaric oxygen, now it's not a primary form of treatment, it's an adjunctive form of treatment. But what we're doing with that, so it's in addition to the standard of care for one.
Okay, thank you.
Yeah. So what we're doing with that is it's really the only thing that's proven to provide neo-revascularization. So it can restructure that capillary bed in the wound, right?
Do you say neovascular?
Yes, neo-revascularization.
So making new veins. Okay.
Making new vessels.
Track it.
Yes.
Track it. Keep going.
Yes. So basically, while you're in the chamber, you're at a depth of 2.5 atmospheres of pressure. You're breathing 100% oxygen. What's happening is we are higher
than.
Yeah, we are hyper hyperoxygenating your plasma. Dumbed down. That's what we're doing.
So you're putting more oxygen in the blood plasma than is normally there. You're it's like when they make treated power poles, they put them in this chamber and press the treatment into the wood.
Correct. Yeah.
So you're doing that to people's legs and bodies
with oxygen.
You're forcing more oxygen into their body than should be there.
I mean, what is life? Life is oxygen.
Well, I don't know. You're putting them in a tube and closing them up in there. Like, do people freak out occasionally? Like, what?
Sometimes.
Yeah.
So what we do is anybody who's got a history of anxiety or confinement anxiety, what we're going to do is we're going to do a little test run. We'll put them in the chamber without kind of closing the door and locking it and see how they handle that, just to see. And if they do have that history of anxiety, a lot of times we'll have their primary care provider prescribe them an anti-anxiety medication or something.
Fair,
like that. Yeah.
So, okay, that makes sense. I think I'm nerding out because I get it, all the words. Like I'm seeing it, but
it's really cool. Yeah. If you've never seen it, come by. Can I
get in there without doctor's orders?
In the chamber?
Like, can we do like a remote? Because we said hear me. We said like we did our 50th episode with the three directors and myself.
Congrats.
It was fun. No plan, but anyway, we said we're gonna do some like on-site shows, and these got Seed Creator. They're like, yeah, where are we going next? Let's go. So we want to do something on site. So I'm thinking like when we do this NST and we eventually get something cooking in North Alabama, like we get a class at your place at Crestwood, and they run an NST course. But while we're there,
come on,
we jump in, and I don't want to get into like the Rick and Bubba show, like Speedy and what other guy,
right,
Helmsy doing all kind of crazy antics. But like an NST person might work in your facility.
Yes.
Okay.
They could.
So they need to know like what is hyperbaric medicine and how this works, and so it might be a good segue. But seriously, could I get in there? Like just hop in without orders? Can I get Julie to write me a note, my boss?
Technically,
no. We need to say no right now.
Yeah, technically we can't do that.
You said technically.
Yeah, technically we can't do that. However, if you did have a qualifying indication, then we could put you in there.
So you're telling me there's a chance?
There's a chance. There's always a chance. The answer is never no.
Well, that's what Brandy said earlier. Like we're talking about with these kids, like some kids, like the answer is not ever no. There's always a way.
FYI, I'm probably the best person ever at doing this, figuring out how I can get a patient to go into the chamber and it be approved under their insurance.
I can see that. You're very persuasive, for sure. So, okay. This is really cool stuff. How would an NST, a young nurse support technician, fit into this unit? Like they've gone through our class, they don't have a nursing degree, they've never seen your medicine, your clinic, they just want to help people. So how does a young NST student completer fit into your work?
Yeah. So what they would end up doing if we had an NST. Right now, that's not one of those right now because it's not really a thing yet, right? But eventually we could present this certification to Crestwood, Hillogics and say, hey, this is a role we could probably train in hyperbaric medicine. Now, I do have to throw this disclaimer out. Anything I say is my opinion.
Sure, yeah.
It's not necessarily the opinion or view of Hillogics.
Nothing here is
Crestwood.
factual. Yeah.
So that person could technically fit in and be a hyperbaric safety director, right?
Oh.
And they could, or a hyperbaric technician.
Yeah. Okay.
So what they're going to do is they're going to treat the patients with hyperbaric therapy. And that's, per patient, you're looking at roughly about 2 hours a day. because there's a little bit of travel time when they're going down to compression and then coming up from decompression. So,
Okay.
so yes, they could. And if they didn't want to do that, then they could probably do something like discharge assistant.
Okay.
And what they would do there is help redress the wounds, or they could help with intake and clean the wounds, prepare the wounds for the nurse to come in, do that assessment, and communicate with our physician.
Okay. So an NST could directly address or assist with wound care. Like, so the nurse, the RN comes by and says, okay, here's Bob, and Bob has this whatever wound. You need to do X, Y, Z to it. I'll be back later in an hour to check and make sure it's right.
It won't be that long. We're
Okay.
very efficient.
Well, yes, of course you are. I'm just saying, in general.
Yeah.
So that's how it's going to work. Or they might say, hey, here's your NST certificate. You go work at Jesse's clinic, and you're going to work in discharge, which is all a part of nursing, right?
It is.
It's just what the nurse needs that day.
It is.
Or you could say, hey, here's our hyperbaric process, and we're going to train you on how this works. So there's still an NST working one of these three areas, but with the hyperbaric part, it's much more controlled. And would normally an RN be the only one to be able to do that, or do you have to go through training to be a hyperbaric person?
So you still have to go through the training.
Okay.
Which
exists.
Okay. Yeah. So you can, Hillogics provides that education and that level of center level certification to allow team members to perform hyperbaric oxygen therapy.
Okay.
Now we've got me, Molly, Marana, Haley. We've got 5 people in our clinic alone that are approved to provide hyperbaric therapy to our patients.
Okay.
One of them is a licensed paramedic. So
Helpful.
those degrees currently are medical assistant, CNA, RN, LPN. Am I missing anybody?
EMT?
EMT, which would be like a paramedic.
Paramedic. Okay, yeah.
Yeah. So and
those
you
are
have
the people in your office that are certified to do hyperbaric.
No, I've got 4 RNs that are certified,
okay.
and then I've got one licensed paramedic.
Okay, got it. So that's really cool. So these young people can get the NST and come work with you, and maybe they're in school.
And there are so many other options, Houston. There really are, because once they, and I'm just speaking wound care in general. Once they get in there, they learn a couple of things. There are options for them to go maybe work a front desk. There are options for them to do stuff with on the back end, like insurance side, right? They can, like, we place orders for DME, which is durable medical equipment, to companies.
Yeah.
And they could be on that backside for a durable medical equipment company, saying, hey, these are the supplies this patient's going to need. So the medical field's not just nursing. It's not just, there's so many options.
Okay. So when I was at Calhoun, we had, in the non-credit side, because the degree side had RN, and I think they just came around to LPN, maybe Calhoun, maybe recently. And the colleges around the state do different levels. But then we also had the CNA, non-credit. You could take your first semester of nursing and take the test, and so you're a credit student, but you're a CNA, so you can work. But then you also had medical billing coding.
Yeah,
I want to say medication aid. That's another thing. Clinical medical assistant.
Yes,
CMA.
Yeah,
which was like,
that's huge.
Like office work, like running the medical office, right?
So that's part of it. So
educate me.
So we have 2 medical assistants at my clinic.
Yeah.
And so one of those medical assistants runs the front office. So she's our what we call a patient navigator.
Okay.
And she is responsible for everything front office.
Okay.
Checking patients in, getting insurance authorizations, answering phones, etc. And then the other one is kind of back in the clinic, and she's doing all the clinical stuff. So that's what I'm saying. Like, just don't pigeonhole yourself, because know there are so many options out there. If you don't like one, try another one.
Yeah. No. Okay. So I was just asking Frank earlier about plumbers, and apparently they have the slab group.
Okay.
Which I thought would be the hardest part. And then they have the top out, and then they have the, set out, which is the finish.
Okay.
Right?
Yeah,
Everything's done. walls are in, but so, and I said, okay, Frank, so when somebody comes in and they don't like working in slabs because it's whatever, then they move to he's the top out supervisor, or they finish set out, or they don't like any of it, whatever. So he said, yeah, they can move around until they find their niche. So when a young NST comes in, and maybe they're in school to be a RN.
Yeah.
And it's taken them the 2 years, whatever. But they wanted to get this NST course to get in the experience. Rather than working at Chick-fil-A,
Right.
I'll take RN classes.
Mm-hmm.
You're taking your NST and you're working at Crestwood as an NST. So now you're around all these people.
It only
right?
helps.
It only helps. So my question is, if you had a young NST and as they're there working, are they able to bounce around from front end to clinical to the durable medical goods or to direct patient care? Do y'all let them kind of rotate through and see what they like? Or is it like, hey, you got to work here for 6 months and then maybe we'll rotate? How does that work?
So I'm huge on cross-training.
Yeah.
Everybody that works in our clinic is cross-trained to do at least one other job.
Love it.
Just because you never know when there's going to be a need for somebody to fill in somewhere.
Mm-hmm.
And so if you can cross-train in every role, now keep in mind there are scopes of practice that keep them from doing some stuff like case managing a patient's care. But within their scope,
within reason,
they cross-train.
Okay.
Period.
So an NST could do that too? Yes. Like as long as they are supervised?
Yes.
By the... Okay, and I'm going to talk out. Peggy's going to kill me. Miss Benson's going to kill me about talking out of school here. But like, if an NST comes in, as long as there's a person there to supervise them doing that job, it's would work in your facility. As
long as it's within their scope.
Yeah. As long, so you can't have like someone who's a clinical medical assistant supervising someone doing RN level needs.
Correct.
Right. Okay.
That's correct.
So we're appropriately tracking people, just so the world knows. Yeah. We're tracking folks. Nobody's doing work they shouldn't be doing.
Correct.
Okay, that makes sense. When you said cross trainer, it reminded me of the Reebok shoes from the 90s.
Oh, yeah.
Remember those cross trainers?
Oh, yeah.
Oh, those are so...
Oh, yeah.
And like, even the late 90s, they had some... They were cream colored with like green and blue. I digress.
So when
No, keep going.
Funny story. Yeah. When I was in nursing school, forever ago, there weren't a lot of white leather shoes out there. So I got that old school pair of Reeboks.
Oh, yeah.
And I had to paint the Reebok sign because they had to be 100% white.
Oh, right? Man. Did you start like a trend?
No.
I thought you were going to say yes.
No.
Okay. No. Did you get in trouble?
Sometimes I got in trouble. Yeah.
When people look down like, what?
Well, it wasn't for the shoes. It was more for like the scruff.
Oh.
Okay.
Gotcha. What does it look like? I need to get back on track before I get in trouble. What does it look like in the future for you guys? You've got all these people doing all this work in your office. You've got, what did you say?
I've got 4 providers,
yeah,
which include 2 physicians, 2 nurse practitioners.
Mm-hmm.
I've got 2 MAs.
Mm-hmm.
I've got 5 RN. Oh, I'm sorry. I've got 3 nurse practitioners.
Okay.
And then I've got 5 RNs
mm-hmm.
and 1 licensed paramedic,
okay.
and then myself.
But no CNAs. They can't work in your facility.
They technically could, but so that's getting a little.
No.
We prefer the MA.
Sure.
Because of the scope of practice.
Yeah. I got in trouble during COVID. We tried to do a CNA class for a big hospital system in Huntsville,
mm-hmm.
and we were not allowed to. And I was like, people are literally dying because there's not enough care in the hallways, and we can't do it. So because it was an acute care facility, and CNAs are long-term care. So
yeah.
What's cool about this course is like all of your folks here can take this NST course that EMD doesn't need to probably, but they can sit for the exam. CNAs can sit for the NST exam if they've been working for a while, or they can, if they don't have anything, they can come through and take our course and become an NST for the first time. And that's all they have while they're working on other things.
I would like to remind you and everybody that's listening is I started as a CNA, right?
Yeah.
I mean, the crazy thing, my journey in 10 years
mm-hmm.
went from CNA, RN, now then a clinical nurse manager, now program director, all within
mm-hmm.
10 years.
Yeah.
And keep in mind, you're gonna get out of it what you put into it.
Sure.
So as long as you want those things for yourself, the sky's the limit.
Well, and that's all three previous recordings we've had today. Somebody has said that exact thing.
Yeah.
Like we had submarines on earlier, like buildsubmarines.com.
Oh,
okay. Like in Alabama.
Hyperbaric medicine. We should have been together.
I don't think I could handle that conversation. Y'all are all so much smarter than me. But for real, like, and we talked about that. Like, this is, people in Alabama are learning to weld submarines that are going whatever depth, super hyperbaric,
Well, I mean, you have to think about it. Who do you want welding your submarine? Somebody from Alabama or somebody from Oregon?
Well, preferably somebody that cares a whole lot. But anyway, but you're right. It's a good segue. But it's like, she talked about, hey, these people, whatever you want to do in the shipbuilding industry, you get out of it what you put into it.
Right.
The three kids from Huntsville City said the same thing. Like, they took this thing and they's like, I'm only here because I worked hard and somebody gave me a shot, but I took advantage. And Frank said the same thing. He started off as just walked up and got a job with his buddy.
As somebody young, fresh out of high school or fresh out of, a nursing support technician certification, if you walk into your job every single day with one thing on your mind, and that one thing on your mind is, what can I do today to make my boss's life easier?
I think you've told me that before.
You walk in with that mindset, the sky's the limit for you. Because one day I'm changing doorknobs, okay? Then the next day it could be, hey, I need you to do these light bulbs. Then you're the doorknob and the light bulb guy. And then the next day it could be like, hey, can you change the oil on the forklift? Then you're the doorknob, the light, the forklift guy. So once you do those things effectively and take those things off of your boss's plate, they depend on you.
You make yourself marketable.
100%.
And irreplaceable.
Yeah.
So what would you say if I brought to you right now as the clinical program director, if I said, hey, I got these 6 kids right here. They're 18. They're graduating in May 20th. And they've all been through this NST course. And they want to work for Crestwood. What do you do with them?
So for me, what I'm going to do is I'm going to reach out to our Human Resources Administration department. And I'm going to say, hey, we've got these guys who have this certification. How can we get them in here?
Yeah.
And then that process would start.
Okay.
So basically there are some things that they're going to have to apply. They're going to have to apply. There will be background checks, et cetera. And then there are some things on the back end on the administrative side that, of course, Crestwood and CHS will have to make sure are okay. But yeah, that's basically it.
Well, now keep in mind, too, all these NSC students, whether they challenge the exam as an existing medical care or they're just taking it for the first time, they still go through an application process with the ABN.
Yeah.
So the background check, whatever's in the application.
That's fantastic.
So they're cleared a little bit before they get to you.
That's fantastic. Yeah.
And certainly every site has their own process. But the question is, like, from your very niche care facility, that it's very useful. And I know I'm asking yes, no, maybe a little bit.
Is it useful?
Yeah, these NST people.
100%. So I'm also the kind of person I can kind of teach you what I want you to know.
Sure.
And what we really need, because medicine's a broad scope, right?
Yeah.
I mean, there's so many different things, and like we said in the beginning, find what you like and then pursue that. So, I take somebody who's fresh out of nursing school, which is my preference, right?
Sure.
And I want to turn that person into the best RN for wound care I possibly can. And that has happened so many times.
Yeah.
In our clinic, hands down the best team in the world. But they've got to want to do that too. So we could work with whoever. I mean, like I say, we have in my clinic specifically, we have Calhoun Community College that comes in, and they do even preceptorship in our clinic. So
what does that mean, preceptor?
So it's where it's kind of like a student teacher, right? With your education background.
Okay.
You go and you sit under a teacher for a period of time, right? And you learn from that teacher. And then they sign off saying, hey, this guy can be a teacher. So basically the same thing with a preceptorship in the medical field.
Okay.
Yeah.
Got it. Because I think I've heard you, maybe my wife tossed that word around. I don't know. What if I walked in off the street and was like, hey, Jesse, look, we're friends, and I think what you do is pretty cool. Like, can I work for you? With no medical degree, no medical anything. I have CPR certification, like in high school.
Yeah, we could probably look at something along the lines of maybe a front office position.
But what you say, yes, thank you for that answer. Because what I meant for you to not tell me, or to tell me, is that I can't just come in without some kind of anything and work in your clinic and actually handle patients. But if I'm empathetic, I want to help people, I want to be a nurse, but I got to have this NST at least to get in the door to handle patients or handle something, patient care. Okay. Because I was afraid you were going to say, yeah, come on.
No.
Okay, perfect.
No.
Good. We're just making sure, because sometimes like our courses, I'm like, okay, well, so the industry asked for it and we built it and everybody said it was great. And then like, I wonder, like, do you really need something to go get that job? Will they train you when you get there anyway? Or do you need this ahead of time? And I know nursing is very scripted and you know, there's a process and guarded, but I just want to make sure, like, we've spent all this time making this NST, like, where does it fit? Do you really got to have it? And I know that for like long-term care, they got the CNA, but in the hospital, on the regular halls, NSTs are golden.
Yeah.
But in your world and all the other niche cancer clinics or infusion clinics or neurology clinic, whatever, these NSTs can fit in that category too.
They're going to need some kind of medical background.
Yeah.
And
Something.
if you're providing that, that's great.
Yeah. That happens quick.
Yeah.
I
We
know.
can go another 40.
We could. Okay.
But there are a lot of different things, like specifically with Crestwood, it doesn't have to be wound care. You know, they opened the first freestanding ER in Harvest, Alabama.
Yeah.
So they're opening another one in Madison, Alabama.
Mm-hmm.
So if you don't like wound care or working, you know, inpatient in the hospital, maybe emergency's your thing.
Yeah.
Maybe a physician's office just doing well visits is your thing. I mean, those are all options.
Okay. Well, that's what I want to hear. You know, because I'm not a medical person, but I get enough of it to understand where this course fits. But it's good to hear that in your ecosystem of Crestwood, that there's an option for them. What would you say to someone out there that says, hey, man, maybe I want to be a nurse and I want to get in the medical, I want to help people, and knowing your journey, which is very cool, like you've got an extremely diverse background. What would you tell a young person that wants to get into healthcare?
I would ask them how they care about their mother. How do you feel about your mother?
Okay.
Yeah.
Yeah.
And if they show empathy towards their mother, then I would say, can you show that same empathy towards another human being who's a stranger? And if they say yes, then I would say you're probably kind of the right mindset for getting into the medical field. Maybe the personality would be a better term than mindset, but and then I would ask them how dedicated they are, because it's a challenge. I mean, it's not an easy thing to do.
Yeah. I've been blessed not to have a ton of my need for medical care myself, but just sometimes you're in there like, man, I don't know how they're doing it.
And then once you are in the medical field, be prepared. Everyone you know is going to come to you and say, hey, what is this? Have you ever seen this?
Why is it? Never mind. Never mind. Yep. Got it. Okay. What do you want to hear when someone says, hey, Jesse, I heard your show on Innovation Unplugged, and I liked it, and I subscribed, and I shared it, but shameless plug. What would you want someone to take away from it who just heard the story? What would you want them to hear as your final thought from your journey to RN to wound care clinic director?
Yeah.
What are they taking away from this conversation?
Vision is the ability to see the invisible.
That's deep.
Yeah, it is. So look at yourself in the mirror. You may not know exactly where you're going to end up, but if you have the right skill set and the right tools, you will end up exactly where you're supposed to be.
Okay. I love that. People want a prescribed ending in life, a prescribed path, and I think a lot of folks are afraid to live in that gray. I've been living in that gray for so long, man. It's like the best things happen there.
Yeah.
That's
True.
beautiful. Good. I appreciate you coming on. I thought it would be fun, and it was fun. It was insightful. I feel like I learned something, and I'm a little bit terrified, but I need you to find a way for me to get in that chamber. Like, 'cause I got this, my leg hurts. Like, my leg hurts real bad. And
Do you have a wound?
I could make one.
Have you ever had radiation?
No.
Oh, so big thing we can get in there, super easy to do, is like a soft tissue radionecrosis. So someone who's had cancer or something like that.
Yeah.
Super easy to get in. Super easy.
I had a cyst in 6th grade on my leg.
That's not going to get it.
Okay. Good to know.
Who's your insurance provider?
Blue Cross Blue Shield.
Of Alabama?
Yeah.
Okay.
I stay employed, bro. I got Cadillac insurance.
Yeah, there's Blue Cross, Blue Shield, Federal, etc.
Yeah, it's true. Okay, we're digressing, and Jordan's Dawson's going to get me.
Can we have another 10?
No.
Oh.
They say 40 minutes, and it's time to wrap up. So,
okay.
Dawson's been very good to us today to take care of us. All right. Hey, guys, thanks for listening. Jesse, thanks for being here.
Thank you.
This has been a lot of fun. Remember to like, subscribe, and share on all podcast platforms. Have a great day.